I'm Dr. Kemi Omololu. I'm live here at First Consultants Hospital in Obalende, Lagos, in Nigeria, where I'm reporting with regards to the Ebola outbreak that happened here a couple of weeks ago. The update I have here right now is that the situation here involved a patient by the name of Patrick Sawyer. The Liberian man that came to the ECOWAS summit in Nigeria in Cross River State in Calabar, which is another state further away from here in Lagos. He became ill and he was admitted here to this hospital. And what happened next would be a shock to everybody. It is now updated that Sawyer was very upset when he heard his diagnosis once again from this facility. We are now hearing from Liberian health officials that he was warned not to travel. He was told not to travel out of Liberia, but he went anyway, and that he had already contracted the virus from his sister, who was diagnosed of Ebola, and his sister has since died. When Sawyer got here, he felt ill and he was admitted to this facility, and that's when they said he was very angry and he had an outburst where he actually urinated on the healthcare workers here. He urinated on the doctor and the nurses. And so far, one of the nurses here has died. Since I reported here last, this nurse contracted the virus through Sawyer's urine. The doctor, also a female, has been diagnosed of Ebola virus and is being looked on in a critical condition, we hear. Now, update to that, the president of Liberia issued a statement that he was just reckless and that he didn't need to infect people, and he was clearly warned not to travel. What is going on right now is more of a social issue with some people, but it's still an endemic. It's a health issue that's serious, and the social parts of it is coming into place. The only country known to prosecute people that knowingly spread such diseases like HIV is Canada, that I know of at least. I lived there 5 years, so I know of that. You can go to jail for what you did there. Mr. Sawyer has since passed away, the nurses passed away, and the doctor's in critical condition. There is another doctor, Ken Brantley. Dr. Ken Brantley was transported to Atlanta's Emory University last week. The hospital in Atlanta is treating him now with the serum, and they said to be doing well. Also, the missionary, the lady that worked in that same area in Liberia, has also been transported to the U.S. Meanwhile, there has been 3 new cases in Nigeria. And also 2 people have died from the so-called saltwater baths. The saltwater baths is a rumor that went around in Nigeria stating that if you bathe with salt water, you will prevent yourself from getting Ebola or even cure it, as well as eating kola nut and other things out there. None of these things have been documented. The 2 people that died in Plateau State, a mid-northern state in Nigeria, and they died of high blood pressure. They ingested so much salt water that their blood pressure went sky high and they died. It is very important to connect with your pharmacists and doctor and your healthcare professionals. And Nigeria is having a doctor strike, which is not unusual here. The doctor strike has been going on for a while. I actually appealed for them to come back on my TV show. Right now, I write for NTA News Now. Articles are coming on Ebola next week. Today's the 9th of August, 2014. And it is very important to read these articles and to connect with me on social media. HNN Africa is the Twitter for my journalism website, and the hashtag is HNN Health to look for the stories. Also, at Health Reports. At Health Reports is my health handle. So make sure you follow HNN Africa and at Health Reports. The blog is also there, and the Facebook pages. Connect with those as well. I'm going to detail more information about this latest outbreak in Ebola and and how Nigerian officials are trying to contain it. Meanwhile, the World Health Organization has given some indications that the $100 million that they're going to use to contain the virus is going to be of help because they're really aggressively fighting it. So the Nigerian government has actually issued 1.9 billion naira, which will be something around $13 million to us here. But 1.9 billion naira is a lot of money, and they're going to distribute it to the state and the federal health agencies to get the education to where it needs to be, because most of it really boils down to education now. People are not washing their hands. An average restaurant in Nigeria does not have soap in the sink. Men are urinating in public, and once you urinate, you just keep walking and going, and you're going to have to shake someone. And men tend to touch genitals to actually urinate, and urine is a way you can pass this virus. And I have always said this stuff in Nigeria, that this public urination is just not healthy. And now we have a very health conscious country where everybody's washing their hands now, or carrying soap around. Sanitizers are not very common in Nigeria, but it's now going to come to play now that we have such a deadly virus with a huge fatality rate. Some are reporting the fatality rate as high as 90%. So it's nothing to joke with. Body and blood, body fluids and blood are the main ways of transmitting it, and we're trying to tell people not to go paranoid over hugging people or just saying hi, but just wash your hands. Dried meats, remember, avoid those dried meats. Kilishi, dried animals like bats, like porcupines, all the dried bushmeat we call it here. Avoid that at this time, because the virus is in some of those animals, and they don't get lethal until we have ingested those dried animals as delicacies. So remember, it's very important that the Ebola virus must be contained. So don't forget, at Health Reports and at HNN Africa, hashtag HNN Health. Once again, I'm Dr. Kemi Omalolu, lawyer. 9th of August, 2014. Reporting live in Lagos, Nigeria on the Ebola outbreak.